Okay, so good afternoon, everybody, and welcome to today's Future Ready Adult Nurse webinar. For those of you that don't know me, my name is Debbie Cubitt, and I'm one of the Senior Clinical Managers here at NHS England in the Workforce Training and Education Directorate. I'm delighted to have a panel of people here today to support you with your transition from student into registration. So we will go round and just do some very quick introductions, and then we will kick off if that's okay. So Praise, could you just introduce yourself and tell us where you're working, please? Thank you.
Hi, everyone. It's lovely to be here. My name is Praise Babalola, and I work as a staff nurse in the intensive care unit at the Norfolk and Norwich Hospital. I came into the intensive care newly qualified, and it's been such a lovely place to work. I qualified last year, and it's been amazing ever since.
Lovely. Thank you, Praise. And then next up will be Wendy. Thank you, Wendy.
Hello, my name is Wendy Fowler, Nursing Education Advisor here at the NMC. I am a registered nurse.
Lovely. Thank you, Wendy. And Rihanna, please.
Hello, my name is Rayhana Mohammed. I'm a lecturer at the University of Essex and an adult nurse as well. Thank you.
Thank you. And Kate. Thank you, Kate.
Hello, I'm Kate Morgan. I'm one of the Senior Clinical Managers with Debbie, and we've been promoting the Future Ready webinar series across our professional focus and our alternative careers, and also the Future Ready programme, which will hopefully prepare you, which is part of this package. Thank you.
Lovely. Thank you. And welcome to students that have just joined as well. So without further ado, I will pull the slides up and we will get started. Bear with me one moment. Here we go. Okay, so let's go up to the top. So current slides. There we go. So that is us here today. So this is the plan for today. So we've done welcome and introductions, and we've done the introductions in the order of the programme. So we will hand over shortly to Praise, then we will hand over to Wendy, and then over to Rihanna, and then I know that Kate will do some conclusion as well. So without further ado, I'd like to hand back over to Praise. Thank you so much, Praise.
Hi, everyone. Once again, it's lovely to be here. My name is Praise, and I'll be sharing about my journey from being a student nurse to being a staff nurse. It's going to be more like a reflection rather than, me just talking and talking and talking. And I'll go to the next slide now. So I'm a staff nurse on one of the busiest critical care units in the east of England. And if I do say so myself, one of the best hospitals in the east of England. And I underwent the UEA MSc program, which is an accelerated nursing program for those who started off in a different career or have a different degree and would like to come into nursing. It's pretty much similar to the BSc in terms of hours and I think content. The only difference is we were writing and at a level 7. But the main content, I think, primarily is the same. And yeah, I'm 1 year in, so still very, 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 not very fresh, but fresh enough. And on the journey to being fully fledged. I'll go to the next slide. So I didn't always start in nursing, like I said. My first degree was in cell biology and genetics. And very quickly in my degree, I knew I wanted to work. I loved learning about the cells and, doing a labs, but I really wanted to look after sick people. And there were several pockets of inspiration, looking after a grand aunt who had dementia and trying to link it to Alzheimer's and the cells and all of that. But I really enjoyed looking after her. And then in my final year, I started a charity where we were promoting health. We went into communities and we were talking about health education. And then COVID hit, and that was the period for me. I think like many people that I've spoken to, COVID came with that period of clarity where you wanted to do what mattered to you the most. And I decided to go for nursing. I decided to do it and do it. And so if it doesn't matter where you're coming from, it doesn't matter if you come into nursing straight from secondary school or from a different healthcare role or from a different degree, we would experience transition at one point in the other. And one thing that is common to all of us is we have to learn how to be a nurse. And so there's that common element for all of us. And being a nurse comes with several transitions, from being a student nurse being a student in class, to being a student nurse in placement, to being newly qualified, and to being a staff nurse, which I'll talk more about in the next slide. Yeah, I think so. I remember my first placement, and I think if there are any students here, you would probably remember being so unsure, being out of place, hearing a lot of healthcare jargon, and you're wondering. I remember the first time I saw twerked, and I was like, twerk, that sounds very nice. And I just knew that it meant taking the cafeteria, but I never really learned the abbreviation till much later, I promise you. And much later, I think it was in my second placement, I realized twerk meant trial without catheter, and I was like, oh my God. Wow, really? And then sometimes we hear stuff like, oh, the patient has got capacity. I remember my first placement when I heard the patient has got capacity. What we're used to learning in school is mental capacity. And I could just deduce that I think they're talking about mental capacity here, or do they mean capacity to, look after themselves? And so it's just one of all of those things where you're getting used to the language, you're getting used to being a student nurse. And by my final placement, I was so ready. My confidence had grown, and I felt like, yes, I'm ready to take on the world now. Take me in, take me to place, take me to the ward. I'm ready to work now. And I think being a student nurse is very different because you're learning under the framework of supervision. You can always talk to somebody if you're unsure. You can always ask questions. And I think I'll talk about it in the next slide, that I was ready, and then I became a newly qualified nurse, and the pressure was different. And I think it will be in the next slide as well. And one of the things that really helped me, I remember my first placement having lovely supervisors. He asked me, always asking me, from the first day, he asked me, what stage of nursing are you? I said, oh, it's my first placement. And he literally was taking me by the hand, helping me learn all the basics so that it doesn't sound new to me or feel new to me. And like every student, every word is different. At every time in being a student, you're transitioning. You get used to a particular word, you get used to a particular workflow, and then now you have to go to another word and you have to learn all over again. And that's one of the things being a student nurse teaches you, how to adapt, because you are using all of these things and you're transferring knowledge and you're transferring skills and you're stacking them up. And by your final year, you're like, I am ready. And what I expected, and I think it was a lot of internal pressure. I'd done the MSc program. And when you tell people MSc, they're like, ooh, MSc. But what you don't realize, and what I had to realize is, even though I'd had a first degree, I was learning to be a student again. I was learning to work in a different industry within a different domain. And I was learning that it is okay to not know. And so what I have here, what I expected was to figure things out on my own, to be confident, to competent from the first day, and to know how to do things at all times. And what I learned was that competency shows up differently at different stages of your career. When you're newly qualified, competency is being safe, asking the right questions, knowing who to turn to when unsure. And for me, the preceptorship program we had at NNUH was very good. First, you start the induction program, and then we had several sessions where you had protected learning times. If you were on if you were at work, you came to the hall to learn. And I think what I really liked about my preceptorship as well is, in addition to having a structured framework for preceptorship, we have, I think it will be in the next slide, on the next slide. I had 12 weeks supernumerary period, yes, where I didn't have to, I was working with experienced nurses. And it was so beautiful because I was beginning to form my professional identity. I was beginning to form what kind of nurse do I want to be. When you're a student nurse, you're really bothered about passing your exams. You're really bothered about getting a job. When you start work, you move to another level of what kind of nurse do I want to be? How do I want to express myself in this role? And that was what I started beginning to define. We had 12 weeks supernumerary period. And then after your 12-week supernumerary period, you were on a buddy system for a year, which I think I've completed now because I started in May. And so what that meant was, even though you were working on your own, you had a buddy, which meant if you were not sure, you were always assigned a buddy at the start of your shift. You could always ask. And that kind of support was so helpful. As we all know, that period of being newly qualified is such a vulnerable time for newly qualified nurses because of the self-doubts, learning something new. It's just that kind of precarious environment, and having the right support can make a whole lot of difference. And that was what my preceptorship did to me. And also on my unit, we have a dedicated education team, which is so helpful. This means that even if you're at the bedside and there was something you did not understand, you could always get somebody from the education team come to the bedside to help you. And if you had to go do a training, they covered for you while you did the training. So our learning time was really protected. And we have several simulations, several teaching sessions, and it was very much in that 1 year, and there was always that encouragement. My preceptor, in addition to the structure, sometimes would come to me to just check in. Are you all right? Is everything going fine? Do you have questions? And so it's just taking that flexible approach of, I know we don't have a meeting today, but I'm just checking in on you that everything is still fine. You can always reach out to me if you have questions. And that is very helpful, because sometimes sometimes it's not just about the competencies. Sometimes it's also that emotional weight of starting something new and someone telling you, you've got this. And my preceptor was very good at doing that. Too good, in fact. And I think that was pretty much it for my preceptorship year. And at the end of my preceptorship, my clinical educator came to me and she said, you know what, I'm releasing you now. You can now go under your manager. That's what she said. She was like, I'm releasing you. You're free to be. So now I have a band 6 manager. But in that 1 year, my clinical educator was my preceptor while I was the preceptee. And I don't know what's on my next slide. I've forgotten. Yes. For me, very early on, I learned that curiosity is competence. Learn very early. I think that's one thing that helped me, asking the right questions very early, and stacking those knowledge on top of the other, because you will know everything. 1 year in, I'm just in another phase where I'm learning something new, and I'm stacking on top what I already know. So I already know the basics. Now I'm starting to learn newer things, and always ask. There is no stupid question. I had a student nurse work by my side. I wasn't working with him, I was working with somebody. And he wanted to ask a question, and he said, oh, I'm gonna ask this really daft question. And I said, hold it. No question is daft. No question is too stupid. Ask. The only danger is not asking. And lean on your preceptor. And I think people often forget that your 1 year, use your 1 year really well. Don't be afraid. Your 1 year is such a good time, because at that moment, everyone is still keen on, you're new, we want to help you. Take advantage of all the help that you can get. Write things down, revisit them. And yeah, I had this note when I started my nursing program stuck on my board, and it says, you don't need to be great to start. You just need to start to be great. And that has been my mantra. And because there's always something that you need to start, you need to learn, you need to start again. And so don't worry about wanting to be best, just start, and with the right support, you'll be so amazing. You'll be so amazing. You'll be shocked. I promise you, 1 year in and I'm still shocked. Like, oh, I can do this. Wow. That's so nice. And I think that's pretty much all I have on my slide. Yes. I started this journey wondering if I was ready, and I'm continuing in it knowing that readiness is something that doesn't just happen. you build confidence. It doesn't just come in. Confidence is your experience with curiosity, with training, with the right knowledge. And oftentimes when you're at work, you're on the blue uniform, and then sometimes you might see other people in blue uniforms doing things really well. But if you ask them, they have so much experience. And so don't be hard on yourself. And I want to say a big thank you to my preceptor, the NNUH education team, my colleagues at the critical care. It's one of the best departments, I must say. And thank you to everyone for having me here. Thank you.
Oh, praise, that's absolutely amazing. Thank you so much for sharing your insights, and your quotes are really, 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 really good. Been making notes about your quotes. You know, you've really shone through and shown us the journey that you've been on. So really, really big thank you. And you know, there's so much that I could talk about that you've raised today. I really liked when you were talking about using your skills and how you stack them up and how you build on those skills. You've explained very clearly about your preceptorship program and the support that you've had. Sounds to me like you've had exemplary support from your preceptor, and they've believed in you. And what I can also see is from when you were supporting the student that was coming through, how you're now going to be their role model through the role modeling that you've seen and you've experienced. I think as well, the other thing for me that you've really shown is your vulnerability, and that you're very willing to be curious, and you're very willing to say, I don't know, but you know your way around how to support that, and around curiosity as well. And about, curiosity is a competence, and no question is a silly question. So what, if I may ask, you finished your preceptorship program now. You said you were learning something new. What are you learning new? I would imagine in a critical care complex, you're going to be learning something new every single day. So what's next for you? What have you learning new?
I think I'm in that phase where I'm now critically thinking. I look at so when you start, you're learning all the basics, learning how to work with the machines, learning how to identify deterioration. And then you get to that point where you're critically thinking, now, this is the deterioration I'm seeing, or this is what I'm seeing. What is this telling me? And you're learning how to advocate for your patient. I didn't even think it would happen early on, but yes, there is no time to start advocating for your patient. In terms of clinical, so I'm learning more clinical skills. When you start, you're learning a lot of respiratory, and now as you stay on the unit, you get more cases. So I'm learning more neuro, more cardio, and more clinical skills. And I think critical thinking is the phase where I am now, where I am now applying all of the knowledge that I have learned in uni, and also nursing theories. You'll be very amazed at how different nursing theories come up at different stages of care. When the patient is doing much better, you're applying Loper Rogan's 12 assistants of daily living and all of that. When the patient is very unwell, you're using OREMs. No, when the patient is in rehab, you're using OREMs. I think OREMs is where self-efficacy, when a patient cannot look after themselves and you're helping them in that stage. And different stages invites different nursing theories. And you'll be so amazed that, oh, this is what this means. And I think I'm in that phase where I'm now really, really applying all the knowledge that I have received. But critical thinking stands out for me.
Wonderful.
Yeah.
Lovely. Thank you so much, Praise, for sharing your journey. We really appreciate it. I'm very aware that your patients need you as well, and that you've got to get to work. So thank you for joining us. The session will be on record, so you can watch it back. But really big sincere thank you from us all, and from the students that are watching this as well. And we wish you all the very best with your future career. Thank you.
Thank you very much. Thank you all. Take care.
Take care. Bye-bye. Bye-bye. So without further ado, I'd like to hand you over to Wendy. Thank you. I'll just pull your slides up, Wendy. There we go. Over to you. Thank
you. And Praise has just gone, but that was absolutely lovely to hear. I wrote things down. as well. And I think staying curious is really, really important. I wrote that down in big letters. And yeah, something I talk about a lot. There's no such thing as a daft question. Sometimes there are some daft times to ask it, but most importantly, there's no such thing as a daft question. So on to my bit. I'm going to be talking about the role of the NMC. I'm going to be touching on the code and revalidation reviews, but I won't be going through those in detail, but there is detail on the slides, which will be sent to anyone who likes them. So next slide, please. Really just introduce myself. So Wendy Fowler, I'm a nursing education advisor at the NMC. I am a registered nurse, and that picture is in my last NHS role, which is pre-registration education lead, with a student nurse who we were celebrating International Nurses Day, looking back and looking forward, and she's wearing a vintage nurse's uniform, which is my nurse's uniform, so I'm sure that makes me a vintage nurse. Next slide, please. So as I said, we'll talk a bit about the role of the NMC, what you need to do to register with us. I'm going to touch on revalidation, and then we're going to have a little bit of a pause for questions and reflection, and information about the code review and revalidation review can come to you via this presentation. But so I will be focusing on what we do here at the NMC. It's really important to understand what we do as a regulator, and the process around registering, and then what we need to do around revalidation. Next slide, please. So we do have these three key roles at the NMC: regulate, support, and influence. Our core role is to regulate. It's around the integrity of the register, but to make sure we do this well, we need to support our professionals and the public, and also share our intelligence and work with other people to influence things like workforce planning and decision making. But our core role is to regulate, which is probably best explained on my next slide. There it is, everything we do here at the NMC on one slide. Starting off in the bottom left-hand corner is around our standards. We set these standards when nurses, midwives and nursing associates qualify in practice, they feel confident that they've got the skills and knowledge to deliver safe, kind and effective care. And also the public know what to expect from nurses, midwives and nursing associates. So these standards include the code, our pre-registration program standards, and our revalidation processes, standards for return to practice, and so on. And then education, we don't write curriculum, but what we do is we approve and quality assure programs of nursing and midwifery education, which universities design in accordance with our standards. We then check by that process of approval that those programs meet our requirements. And then there's ongoing quality assurance with that. No one can be a nurse, midwife or nursing associate unless they've completed a program that's approved by the NMC. Registration, so this is about maintaining the register of professionals who are eligible and fit to practice. So this includes people who have completed a program of education here in the UK, or completed a process approved by us at the NMC where they've trained overseas and then met our processes at the NMC to go onto the register that way. We also investigate concerns about professionals in the register. This actually affects, it says a tiny minority here, and I often ask people to guess, and I get all sorts of guesses, anything up to 25%. of nurses, midwives and nursing associates coming to the attention of fitness to practice, it's actually fewer than 1% of nurses, midwives, nursing associates come to the attention of fitness to practice. Most of those don't go any further than screening. And it feels like that's all that we do sometimes. That's how we're often perceived. It's all about the fitness to practice cases. I'm all about the other 99%, 99+% of nurses, midwives and nursing associates around implementation of those standards, because we all want the same things. We all want safe, kind and effective care. Sometimes people say to me, oh, go and do something wrong and the NMC will come and take your pin. That does not happen. It doesn't happen overnight. We don't swoop in and take it away. We do investigate concerns, and that investigation is about future safety. It's not about punishment. And I think that's a really important principle to hold in your mind. The other thing to look at is the common theme of investigations which have poor outcomes for the registered nurse, midwife or nursing associate involved is dishonesty and not engaging with the process. It's making a simple mistake will not get you struck off. Generally speaking, it really won't. Being honest about it, learning, and that duty of candour is absolutely vital. We also promote lifelong learning in terms of revalidation, which is every 3 years. And also there's some post-registration courses that we do regulate. For instance, programs of education towards being a specialist community public health nurse. Next slide, please. So here it is. This is slightly mind blown. The process of registering with us when you qualify. I will not read from this, but I'll give you the overarching, but this will come to you. So when you complete your programme of education, your university will let us know that you completed and you've met all the requirements. And this is an automated process. In a couple of hours, we will generate a file for you. And you'll get an email inviting you to register. The whole process does not shouldn't take more than 20 working days, frequently far less than that. So when you finish your course, the university uploads the course and personal details to our database, sends us that declaration of good health and character, and then you will need to create a My NMC account, and you need to pay your registration fee of £120, fill in the application form and declare any police cautions or convictions. Once that applies, we review that application. If you've got everything we need, you'll be on a register between 2 and 10 working days. Sometimes it takes longer, and that's only because we might need a little bit more information. What is absolutely vital is that you make sure you check your junk folder. When there's a delay, that's often the reason. You can actually stop this happening by adding no reply at nmc.org to your safe senders list, and I'll put that information in the chat now because I know that's important. So if you do that to your safe senders, it shouldn't go to your junk, and you should get that information quite quickly. And I'll put there we are. Next slide, please. To talk about revalidation, we are reviewing this at the moment. At present, you need 450 practice hours over 3 years, and that's any practice that where you rely on your skills, knowledge and experience as a registrant. I revalidated yesterday, and I don't work clinically, but I do absolutely rely on my skills, knowledge and experience as a registered nurse. So just remember, it says practice hours, it does not say clinical hours. It's practice hours. 35 hours of CPD, 20 of those hours need to be participatory. What that means is with others. And that doesn't have to be a study day. It doesn't have to have a certificate. It doesn't need points to make prizes. It means any study that's relevant to you and your practice. 5 written reflective accounts, and these are reflections on either an aspect of your CPD or some feedback or something that's happened in practice. What is vital is how that links to the code and actually to the proficiencies. 5 pieces of practice-related feedback. This could be verbal, it could be written. What's important is that focus on how that influences your practice. You then have a reflective discussion with another registrant, which is around those 5 pieces of reflections that you've done. And then you declare online you have good health and character, that you've got a professional indemnity arrangement that is usually arranged by your employers. And then your manager confirms that you've met the requirements, which is done on a form, and then you enter that person's details online. We take a very small sample for where we just might ask for some additional information. You need to keep a record of your practice-related feedback, your reflective accounts, and so on, but you do not send your portfolio to the NMC. No, thank you. We just don't have either the physical nor the virtual warehouse space, and it's yours. It is absolutely yours. We just need to know that you've done it. Next slide, please. Please sign up to our newsletters. We're absolutely the best way of keeping in touch. We do have ones for nurses and nursing associates, midwife students, educators, employers and the public. Sign up for as many of those that you're interested in. Next slide, please. So it's time for our pause, reflection and questions. Has anyone got a question for me? Debbie, I know you've got one. I can see it brewing on your face.
I have, Wendy. Thank you. Thank you so much for a really comprehensive presentation, as always. My question is, if I'm about to qualify and I'm trying to secure a job, but I haven't got a job at the moment, but I'm applying, should I go ahead with my NMC registration, or should I wait until I get the job? What would be your advice, please?
You can wait. You have got 6 months to send in your registration. In actual fact, you've got 5 years. After 6 months, it becomes more complex, and we will ask for additional information. But thinking of myself as an employer, and I have been for a very long time, if someone came to me and said, I'm ready to go, I could start next week, and I would really look upon that favourably. I really, really would. The other thing you can do if you're registered is start accruing CPD towards your revalidation. You can't do that if you're not on the register. If you're not on the register and you do some CPD, it can't count towards your revalidation. And again, if I was your employer and someone said to me, this is how I've kept my skills and knowledge up to date, this is how I started to do something towards my revalidation, I would really think that was favourable. And why wouldn't we? Why wouldn't we want to keep our skills and knowledge up to date? I do think that's what I would do.
Lovely. Thank you so much. Thank you. And then my next question is, what sort of job can I get? So if I'm struggling at the moment to secure a Band 5 staff nurse post, can I go and work as a healthcare support worker or a carer in the community? What would your advice be, please?
Yeah. So two parts to that answer. Firstly, if you're looking for a role, think beyond hospitals. There is always someone who you meet in the car park and says, no, you've got to do 6 months medicine, 6 months surgery in a hospital before you do anything else. To be honest, that was kind of out when I qualified in 1987. So really think beyond that. Be creative. Think of a job that that you're going to feel supported in. it will not be your forever job. It is your first job. And because actually your forever job, your perfect job may be in a service that doesn't even exist yet. So go with the flow. Think about social care. Think about where people needing care are, because think about the 10-year NHS plan. That's not where people needing care are going to be, and they're not in hospitals. Think, I'm an orthopaedic nurse. Not that long ago, if you came into hospital for hip replacement, you were in for about 3 weeks. Now, how long? A day or so. Those people are still needing care. They're just not in hospital. So second part of that question, can I take a role as a support worker? Here at the NMC, we can't tell you what jobs you can and can't take. However, things that you need to be absolutely clear on with your employer. I'm here as a support worker. This is my role. I know that you know I'm also a registrant, but you've employed me as a support worker. Have that full and frank conversation. The other thing which is vital is if you're registered, you're registered. So aspects of the code apply, and that includes things like escalating concerns. That includes acting as an emergency. However, having no one to do the 6 o'clock jog round is not an emergency. So we can't stop you. We can't say what job you can and can't do. But you need a very, very honest conversation with your employer.
Lovely, thank you. It does, definitely. And then one of the questions that I know the work that Rihanna and I have been doing with preceptorship is around if I'm dual field.
Yeah.
So not dual registered, dual field. So I might be an adult and a child registrant, or I might be adult and mental health. Any advice for me there, maybe around revalidation and what I can do? Thoughts, please?
Yeah, you firstly, you revalidate as a registered nurse. And you will need to think about how your CPD, your reflections, your feedback encompass what you do in your role. And that goes for all of us, whatever role we're in. If you have a dual field, you may want to illustrate within your reflections, your CPD and so on, how you're using both fields. And let me think of an example real quick. If you're a registered nurse in the field of mental health and adult nursing, for instance, and you work in, let's say, a medical assessment unit, I don't think you'll probably go beyond your coffee break without using both those skills. Think about people who may be coming in with an intentional overdose of medication. Think about someone who may be exhibiting psychosis. Think about someone who is perhaps experiencing delirium, and maybe it's being interpreted as a psychosis. You will be using those skills, and the same goes for children. For instance, a child and mental health, learning disabilities and adult nursing. You will be able to reflect on those experiences that you're having where you're using all those skills. We all bring all of us to our role. And I think that opportunity for your revalidation is to really show how you can do that. Have conversations with people to say, actually, I'm reflecting on my skills as a mental health nurse here. Sometimes just saying that out loud makes it really feel very real and make it kind of constructed those sentences for you ready for your revalidation. Is that helpful?
Absolutely wonderful, Wendy. Thank you, as always, for your openness, honesty, and very, very clear explanations. Really, really helpful. So, Wendy, thank you so much for your presentation. We really, really appreciate it. And I'm going to hand over to Rihanna now. I'll just get your slide up, Rihanna, and just bear with me because I've just got to move along a little bit. And there's lots of other slides that we can share at another date around the code and revalidation. But Rihanna, thank you so much, and over to yourself.
Thank you. Thank you so much for inviting me to be part of this and also to share my career journey with yourselves and also with the student as well. I really feel privileged to actually be able to share that. To put on my career journey, then what's next? I feel like I wanted to share that in the sense that I want to highlight that even though I've put then, now, and what's next, it is what happened in my then actually influenced my now, and it's actually going to influence my next as well. So you find that that journey is not it's my current journey actually relies on what happened before and what's going to happen in the future as well. You also find out that in my career journey, you notice that my career is actually inspired by what has happened to me throughout my life. It's actually started and actually ongoing by what I'm inspired by. Because I think when we are inspired by something that is positive around us, it motivates us to actually grow and do the right thing. You also notice throughout this journey that our career is not a straightforward journey. It's more like a jungle gym where we climb up, we go sideways, and then we maybe step back. You might find out that you have to step back to actually move forward. And you actually see that in my journey that we are not really, our career journey is not straightforward. And you notice that as I go through this slide. But having said that, I've always wanted to be an educator, and it's actually transpired through my then, now, and then also what's going to be next as well. I was inspired by my teachers in a junior secondary school, which is actually around GCS and also primary school in the UK setting. So I've migrated from Ghana, so I see myself as somebody who's come from an African country into UK, but that inspiration to be an educator was actually grown and developed from my teachers when I was in primary school, especially my math teacher, who actually was very good in supporting our learning towards and how we grew as students, and especially in the area of math. He actually spends time to let us come to his house to do on a weekend, so outside of his teaching role, to teach us maths free of charge. And he spends time with us so that we will grow our knowledge around math. He went as far as developing a poem for us to inspire us to become to be good at maths. And it goes like, God loves you and he loves maths. If you know math, you enter paradise. And this is actually something that's more than 35 years ago, and I still remember this poem that he actually developed. So you can see how this teacher has actually created a very strong love for teaching and supporting people, and it's actually stuck with me. And among some of my teachers in the primary school, they actually noticed the fact that I loved supporting my peers and supporting teaching. And they asked me to volunteer in marking my peer work. So I would go to my teacher's house over the weekend. It's actually about 30 minutes walk from my house. And I was quite excited at that age to go and mark my students' peers' work for free out of my time. I was like, I think I would be maybe not less than 15 years. I was actually young at that time to go and mark my peer work. As I was creating this slide, I just thought about further at that age, I was able to actually keep confidentiality, that I didn't tell my peer their grade. I knew their grade at that time when I marked their work. So I'll go to class, I know what grade they've all got because I marked their work. But then I never said anything to them about, I know what you got. I was so quiet about it. I was actually very confidential about it. Of course, but the teacher would take my work and mark my work separately without letting me know my grade. So I didn't know my grade until it's published in the school. So thinking about the fact that I was able to actually be confidential at that age and not tell my peers what their grade was actually interesting to me as I was creating this slide. I also went on into my my secondary school. That inspiration continued actually, and I kept supporting my student peer around when they were struggling with their learning. The head teacher actually appointed me to just do that with some of the students who were struggling with their learning in the secondary school, which is A-level in the UK education setting. So I spent time with my student peers who were actually struggling with specific subjects, especially in the sciences. So I sit with them and then go through some of the topics that they were struggling with to support their progress. So that build is actually growing, as you can see in there. And then I went on to do my degree in herbal medicine. I wanted to do medicine by itself, like medicine, but things didn't happen the way I wanted it to. So the opportunity came up for me to do a BSc in herbal medicine. It's actually, we were actually the first cohort for that program. So it was the first time it was being introduced in Ghana. So we were the first cohort to undertake the BSc in herbal medicine. After the program, I decided I was given a good opportunity to do work with another organization within the UK, within Ghana. But then I thought about, I think I want to grow my knowledge around it, because especially considering we're the first cohort to do this program. So I thought, is there any country that has would offer a master's degree in this program to actually grow my knowledge before I come to actually practice? So I researched and found that UK has got the master's degree in herbal medicine. So I decided to move to UK. During my 4 years program, I came to UK on a learning. There was a program that brought degree students to come and review UK and look at the education system and get to know what is being offered here. So I actually had some exposure to UK education before I qualified as before I got the BSc in herbal medicine. So I actually knew about UK before graduating. So when I decided to explore my master's degree, UK was actually what came to mind, because I've actually come to spend some time here to understand the education system before qualifying. So I decided to come to do the master's here. But I came and life had its own plan for me. I didn't end up doing the MSc herbal medicine. Things changed. They had several things happening. And I ended up finding myself working as a healthcare assistant in different sectors. Some of them was the nursing home, and then in the hospital as well. So in one of the nursing homes, I worked as a healthcare assistant for almost 4 years, I believe, or 3 years. But during that time, the manager of the care home actually asked me if I would be happy to become the trainer for the manual handling and BLS. So they actually noticed the way that I find myself, even though I was HC, I was teaching people. I ended up finding out myself always teaching. So they actually found out that I was teaching on top of being a healthcare assistant. So they actually said, we want you to go and do the training and to teach the manual handling and BLS. So I did that training. So I'm a trainer. So I've got a train the trainer certificate to deliver manual handling and BLS and I'm still doing it now for my student at the University of Essex. So I did that for a bit. And then an opportunity came up within the same organization for an administrator, because they lost the administrator. So they wanted me to cover that role. So I covered that role for a bit, and I was working as a trainer as well as HCA. So it was I had a lot of tentacles within that organization. I was doing a lot of things, but it actually inspired me to actually say, it's time for me to explore other opportunities. So I decided to go out there to work in the Barnett and Chase farm as a healthcare assistant. In that role, I worked with some amazing nurses, who I actually connect with still. So we have a WhatsApp group that it's been no more than 20 years, and we still connect with each other. We have a WhatsApp group that we connect with each other. They actually saw me as one of them, in that even though I was a healthcare assistant, they added me to their nursing WhatsApp group. So, and they actually inspired me to say, go and do your nursing. You're good at what you're doing. You're good at helping people. Go and do your nursing. So they motivated me, and I decided to come and do the master's degree in nursing at the University of Essex. So even though I came to the UK with the hope of doing MSc in herbal medicine, I did MSc in nursing, which I feel it's actually still related, because it's all about helping people. And I really enjoy, and I'm actually happy that I ended up doing the nursing program, because it actually informed my next what I'm doing now and how I'm progressing forward as well. After my degree, I worked with emergency assessment units at the Colchester Hospital. I enjoyed that role. I enjoyed the fact that I had that opportunity to assess patients' journey and get them to actually move towards to get that continuity of care. It was an amazing opportunity for me. But during that time, I always had at the back of my mind, I want to be an educator. I want to be an educator. So the university that at University of Essex came up, made me realize that there was an opportunity for me to come and support the clinical skills learning of the student. So I actually volunteered my time to just go and support the clinical skills sessions for the student at the university. So I was working full-time at the Chaft, and then volunteering my time to support the students and clinical skills learning. And during that time, an opportunity came up for me to apply for a practice educator role, where I was supporting students learning at the trust. So I visit students, and more like a link role to check how students are progressing and quality assuring the student placement journey. Through that time, even though I decided to do that role, I didn't want to leave practice completely. So I decided to apply for a role with NHS Professional. So I'm still connected with NHS Professional, because I want to continue practicing, so that I will have up-to-date knowledge and understanding when I'm teaching my clinical skills for my students. So I still do that anyways as part of my my career. Within the practice educator role, I was able to work with one of the senior lecturers at the university on a HE project focused on clinical learning experience. So that's where I met Debbie, actually, at the PAH. So I did some questionnaire and looked at how student clinical learning experience and what we can do to enhance it. So I did some focus groups and did some questionnaire, and it's informed, I believe that's what informed the current clinical learning experience projects that has actually developed a lot of different principles and projects and strategies that are being put in place currently. I went on to apply for a lecturer role when the practice educator contract ended, and that opportunity came up, and I decided, let me go for it. So I applied for that role. Within that role, I think with all roles, I believe learning is an important part of being an educator, and advanced HE actually sees that as an important part of our role as educators, and even practice nurses as well. I think it's very important that CPD is an important part of our growth. And actually, when you shared that around, when it comes to our revalidation, we need to actually reflect on our practice and also our CPD as part of our revalidation. Within that, I've done the medical and clinical education diploma, where this allowed me to register as a fellow with the advanced HE, who actually quality assure, oversee the excellence of education and transformative education within the higher education setting. So the advanced HE, as educators, we have to be registered with them. So I registered with them. I went on to do a PG set in medical simulation, because I was quite interested in simulation, because I supported the clinical learning of our student. So from there, I ended up doing the medical simulations training. This actually inspired me to do my PhD, because through that simulation course, I realized that there are gaps around interprofessional simulation, and also supporting patient safety around promoting collaborative practice to support patient safety. So I decided to do my PhD in that area. So that's what I've started that now. I'm in my second year of my PhD and hoping to actually go ahead with that and finish. So I'll talk more about that in my next. What's my next? But currently, I know I'm a lecturer currently, but I see myself as a leader, an innovator, and also a researcher as well. So I'm not just focusing on lecturing, but I do a lot of things around leadership, working with collaboratively with people to innovate the way we teach, and also research to contribute to the way we deliver and promote excellence in education. I've been involved in developing policies around reasonable adjustment at our university, and also a professional appearance policy that is actually helping students to know, and when they go into placement, how they should look and what they should be wearing, and at what point what is accepted and what is not accepted, so that there won't be any gap between what is expected of them when they are on placement, and also within their university education as well. So this is a policy that we have in place at the University of Essex. Within that role of being an innovator and supporting excellence in learning, I worked with and I'm still part of that group, where the Midland, Yorkshire and East Practice Learning Group. We worked together to develop the MyPad when the SSSA standard was published. So we developed the MyPad to align with that, and this MyPad is being used by almost all the universities in the east of England, I would say. So it's being used across board. I also lead the interprofessional learning and working within the School of Health and Social Care. And through that, I worked with Debbie and then other practice partners like ePort, MSc, and also ESNET, to develop a preceptorship awareness program. And we've delivered a couple of that sessions, and it's been really welcomed by our students. And it's actually, hopefully, we'll keep on doing that and continue raising the awareness around preceptorship. We actually presented that at one of the conference recently, and at that conference, I met a student who actually qualified previously, who didn't attend our previous session, and she actually said that she wished she attended that session because she missed that opportunity to attend a preceptorship day. So they gave her 2 days in a shift in her rota, and she wasn't aware of what to do with that. And she didn't attend that preceptorship teaching event or timing, because she wasn't aware of what it meant and what she needed to do with those 2 days. So I'm glad that we have actually started this and supporting the students' preception awareness so that they don't miss the opportunity when they are when they are newly qualified. I'm also working on the multi-professional student evaluation. On top of that, I also work the audit as well. So we developed the interprofessional student evaluation tool that is being used currently, but there has been they found some gaps in there. So we're actually reviewing that at the moment. So we hopefully would be published very soon once we've actually updated the version that we're working on. In also my role as, I would say, more of a supportive thing, because in this role where I support the international student, it's not really, I do it voluntarily because I know my journey as coming from another country into the UK. Having that support is very important to allow you to transition into a new educational system. So I volunteer my time on it to support the international student within the School of Health and Social Care. I meet them every month just to check how they are doing and if they have any concerns, and if they identify anything that they are not being supported or they are not aware of anything, I signpost them and also raise it to the higher people, senior colleagues within our department, so that their journey would be seamless and also easy for them, because I know where they are coming from. I also chair the BAME Staff Forum at the University of Essex, where we support each other. Because as you're aware, for me, equality, diversity, and inclusion is actually core to my role as an educator. And to be able to do that well, I need to have that supportive network from my colleagues and within the school, and also create the right allyship. And through this BAME chair forum, we do that. We support each other and create the right allyship to allow us to undertake our role as educators. We've developed the BAME and staff mentorship program through this forum, where we do mentorship for our BAME colleagues at the school. What's next for me? I would say, with our career, we need to find out that the way the world is changing so much that if we have to find a way to become great problem solvers and lifelong learners, because we have to find a way to solve the problem around our world, because things are changing. So how do we become great problem solvers and lifelong learners? And that's what's next for me. Find ways to contribute in any way to make education more excellent and transformative, and also continue with my learning to actually contribute to that as well.
Wonderful. Rihanna, thank you so much for sharing your
you.
journey. What a wonderful journey. And I also noticed on your slide your little words of wisdom. The world is your oyster. It's up to you to find the pearls, by Chris Gardner. And you know, it really all heads back to your wonderful maths teacher that supported you and saw the teacher in you. You know, absolutely fabulous. And you know, you're doing so much to support so many learners, and obviously it's your legacy inspiring the future, like your maths teacher inspired you. So we're so grateful for you sharing your journey, you know, and doing it in so much detail as well. I'm sure it will be so useful for our learners to listen to and understand and see the journey that you've taken. And I'm so, if I may, so glad that you didn't do your MA in herbal medicine and that you became a nurse as well. Yeah, absolutely brilliant that you were obviously very clearly destined to be a nurse, and it's been a privilege to work with you on so many projects as well. So thank you for your support and for your leadership.
Thank you.
Absolutely amazing. Thank you.
Thank you. Thank you.
So I'd just like to give the final word, if I may, to Kate. I'm aware that we're short on time, but Kate, I believe you're just going to give a snippet of an overview of the Future Ready webinars for students to know about. Thank you.
Thank you, and thank you, Rahana. We're definitely got squiggly careers on this call today, and we hope that those that are going to listen to this on our Multi-Professional Learner Toolkit app and on YouTube will also really benefit from those career careers that our profession enables us to do. And that's what the Future Ready webinar series is here for. It's to help build your clarity and confidence and help you develop that career direction for your future. And there's 6 sessions already on the app. If you want to go and have a look at them now. There's one on designing your career vision, exploring opportunities and searching for jobs, interview for success, establishing your personal brand, CV writing and applications, and what happens after you qualify. And really would recommend you go and watch all of those. And there's also additional information on the hub. So this is the Multi-Professional Healthcare Learner app. So you can see it, all of these are under career preparation, which is hopefully where you found this. But we've also got our Future Ready career alternatives, alternative careers, including armed forces, pharmaceuticals, and a great one from Indeed. So you can look at how you search for jobs through AI. And Future Ready Profession Focus, which this forms part of. So we strongly recommend that you go and look at those other films. And there's also a great deal more information actually on the Student Hub, which is also on the app, which was designed by students for students. Please promote the app to your colleagues on your programme and tell them about this webinar. Thank you very much.
Lovely. Thank you so much, Kate. Thank you. So on behalf of myself, I'd like to extend a really big thank you to Praise, Wendy and Rihanna and Kate for your presentations. And we hope that we have supported and inspired you to look for careers and to have some grounding and understanding of your future as a professional, as a registered nurse. So thank you for your time, and please do make the most of the resources that are available. Thank you and goodbye.
Thank you all. Bye bye.